We are doing lab activity number 15, Disclosing and Biofilm Index. Something very important to note about disclosing your patient is making sure that you do a gingival assessment and you have your CI check the gingiva before you disclose your patient. So the first step is to apply Vaseline generously to prevent staining on your patient's lips. We don't want them leaving with bright pink lips. Next, we will have our patient chew a disclosing tablet and swish for 30 seconds while sitting upright. When they are finishing chewing and swishing for 30 seconds, they will spit into a cup. Then you will place your patient into the supine position and you will rinse them with the air water syringe, and we will evacuate with the HVE. Now you're going to examine the entire dentition of the patient and just get an idea of what their current level of oral hygiene is. Just a general overview. So right now, what are we seeing? It is bright pink between the teeth and a little bit on the cervical thirds, mostly in the posterior. Then you're going to come over to your green sheet, which was previously yellow, so it might say that on your paper, but it's green now. And you're going to fill in the biofilm index for today's visit in the first section, the first visit. Then you're going to look at every single tooth, and you're going to put a positive mark for any portion on the facial or lingual cervical 1/3. So if it's near the gingiva and down 1/3, that is considered a positive mark.
We can just go down here.
So down here we can see these would be positive marks on the buccal surface of these posterior teeth here. So our clinician right now is checking all of the teeth, and then she'll turn to her paper. She'll put little dots on every tooth surface that has a positive biofilm mark. Remember that we're looking at the maxillary, the mandibular, and then facial and lingual surfaces are written on the paper to show you where to mark. Now to figure out the biofilm index, what we're going to do is count up every positive surface that had biofilm on it. And then we're going to count how many teeth there are, and we're going to multiply that by 2 because you're going to be counting the lingual and the buccal surfaces. So then you're going to take your number. In this case, it is 25 places of biofilm. There are 28 teeth, which times 2 is 56. And now we're going to do the math of 25 divided by 56, which gives us a percentage of 45. Now that we have the percentage of the biofilm index, we're going to come back to our patient and we're going to discuss the findings with them. We're going to give them a mirror and show them exactly where we found the biofilm.
Okay, so you can see, looks like you're brushing your top teeth really well. So you can see just a little bit heavier on these back bottom teeth on both the right and the left side. You see how it's just a little bit darker pink right along the gum line there?
Yeah.
Yeah, so what that is indicating is that you've got a little bit more of that plaque biofilm that's just building up in those areas.
And now we're going to have the patient show us how they brush their teeth normally, and then we're going to demonstrate to them the proper brushing technique or help them increase their technique.
right, overall that looks pretty good. I would recommend, I'm gonna have you hold that mirror. I want you to slow down just a little bit. Your angulation looks really good. You've got about a 45-degree angle towards the gum line, which is exactly what we want. But I want you to slow down just a little bit when you're brushing and focus more on doing those nice circular strokes, okay? Rather than going back and forth or in an up and down motion, okay?
And then have the patient demonstrate back to you the technique that you taught them.
Like this?
Yep, that looks a lot better.
And now we're going to interview our patient about their brushing and flossing habits at home.
So how often are you brushing at home?
I brush twice a day, morning and night.
Good. Are you using an electric toothbrush or do you have a manual toothbrush?
I do both.
Nice. Which one do you use more often, would you say?
I tend to use a manual in the morning and an electric toothbrush at night.
Good, very nice. How about flossing?
Yeah, I'm not as good as I should be.
Okay, how many times a week on average would you say?
I don't know, like maybe 2.
Okay. Do you like to use like regular string floss or do you use little floss picks? With plastic
No,
handles?
can't use those floss picks. They get stuck in my teeth and then I have to cut them out. It's very stressful, so I just use regular floss.
Okay. I'm going to have you demonstrate that technique for me if you could. Have you hold on to that. Okay, I'm going to have you hold this mirror. And some things that will probably make flossing just a little bit easier for you is in order to be able to manipulate it, it's going to be a little bit easier if you don't have quite so much space in between your fingers.
Okay.
So if you close that space, it's going to make it easier for you to manipulate that. And then I also want you to make that C shape. Okay, so you're going pretty straight like that, but I want you to really hug that tooth with the floss. Okay, and then you'll go up and down after that, and then hug the opposing side and go up and down again. Okay, does that make sense?
Yeah.
Okay, I'm going to have you demonstrate that back. Good, very nice. Do you feel like you have a little bit more control over the floss there?
I totally do.
Okay, great. That looks much better.
And after we finished speaking with our patient, we're going to put all of this information into our charts under the OHE section. After you have all of your significant information, you're going to transfer it to your treatment record under the code OHE. And you can follow the treatment record prototype that you'll have in your clinic manual. And if you come down to OHE, you'll see the important information you must copy. So that will include the biofilm index percentage, the statement, the OHE discussed with your patient, what they currently are doing, what their goals are, and anything that you have dispensed to them or given them.